So Charlie, we've seen lots of different types of wounds in our clinical practice. I'm thinking about acute wounds and how they can heal in a matter of weeks. So these could be sort of injury-related wounds or wounds that are surgical wounds. What kind of acute wounds have you seen in your practice?
So trauma wounds, so that could be your skin tears, it could be lacerations, it could be penetration type wounds, it could be burns, or it could be post-op surgical wounds. And if we get the treatment right for these really acute traumatic wounds, I suppose you would call them, then we can heal these quite quickly. It's if we don't get on top of that treatment very quickly and prepare these wounds appropriately, that we could see these acute wounds ending up to being hard to heal and chronic further down the line.
So working with a really robust system of assess the wound and the person holistically, wound preparation being really important, whether that's cleansing or debridement, depending on the wound, and then an effective treatment is really important. So if you've got a wound that has any kind of a gap, whether it's a small 1-2 millimetre gap or a bigger 2 centimetre gap, you want to look at a conforming dressing that's going to be able to manage that dead space and protect the peri-wound skin and the wound edge.
Absolutely.